Friends, citizens of the world, fellow lockdown detainees, these are dystopian times. We're isolated, we're disconnected from our friends, in a society that's super individualistic, and I don't think that's helping anybody. Do you? I'm going to talk to you tonight about some things that I'm passionate about and some concerns I have going ahead. But this kind of disconnection, this kind of disaster, the pressure will increase on our mental health system as well as our health system. And I don't think our psychiatric paradigm is working. And I'm going to talk about some studies that are independent, large, peer-reviewed, and long-term, rather than the short-term studies that the people peddling a lot of psychiatric drugs will talk about. In the 1700s, the Quakers had an asylum in Massachusetts, and they had better results in the 1700s for treating people with schizophrenia, depression, and all sorts of psychiatric illnesses than we do now. Part of the problem of the way we're treating these ailments now is we're trying to treat what is a spiritual affliction as if it's some kind of chemistry thing. And it's just not true. In the 1980s, we were told that serotonin deficiency is depression. And depression was merely a lack of Prozac. However, there was never any evidence to suggest that there was a serotonin deficiency in the brains of people who are depressed. The studies that were done only on people after they were taking SSRIs. SSRIs are serotonin selective reuptake inhibitors, increasing the amount of serotonin in the synapses in our brain. I will just refer to them as antidepressants from now on, because these were supposed to be the magic bullet for psychiatry. And unfortunately, we've spent billions on these, and we haven't seen the reduction in disease burden that you expect. When you find a real cure, you spend a lot of money on it, you see disease burden reduce in society. We've seen the opposite with these drugs. We've seen disease burden increase with the more we use them and the more we spend. We'll talk briefly now about schizophrenia. Schizophrenia is a terrible ailment with a 1% prevalence worldwide. And they've invented new antipsychotic drugs for the treatment of schizophrenia. And the World Health Organization did a large study comparing the outcomes in poor countries like India, Nigeria, and Colombia, versus the outcomes in wealthy countries like the USA and privileged countries like the countries I come from, and many of you will come from too. And their finding was, after 15 years, a long-term study, very high-quality study, that the outcomes were worse for people treated in wealthy countries. And what they also found was, in the poorer nations, antipsychotics were used acutely only at the moment of psychosis. However, in wealthy nations, the antipsychotics were maintained, often for the whole 15 years, often for a lifetime. And therefore, people didn't get as well. Again, this is the opposite of what we expect. In a wealthy nation, with a drug that works, a curative drug, we expect the disease burden to decrease. And that simply hasn't been the case. In wealthy nations, since the invention of SSRIs in the early 80s, we've seen a 4-fold increase in people who are permanently disabled due to psychiatric illness. We've seen a 35-fold increase in the amount of psychiatric drugs used on children. And there is no evidence to support the use of these drugs, especially no long-term evidence. with the case of antidepressants. Antidepressants, there is evidence for SSRIs working on the most severely depressed for a period of less than 4 months. But this is not how these drugs are being used. These drugs are being used for people with anxiety, mild depression, moderate depression, severe depression, and they're being used for the whole lifetime of the patient. And beyond that 4 months, there is negative consequences for that. At Duke University, they did the largest ever long-term study on the use of SSRIs and compared that to exercise. Their results were quite astounding. They had 3 groups. The first group received an SSRI or an antidepressant. The second group received the antidepressant and exercise. The third group received exercise alone. And which group would you expect to do the best? As it turned out, over the long run, the group with the fewest relapses back into depression was the one using exercise alone. In the short term, in the first 4 months, the SSRI groups did quite well. But beyond those 4 months, they did very poorly, with only a 3% recovery without remission back into their depression. So 97% of the patients taking the antidepressant remitted back into depression, often worse than they had begun. And curiously, after the 4 months, the exercise and antidepressant group was the worst of all. It seemed like the antidepressant was serving as an anchor, meaning that countering the positive effect of exercise. And this is another major problem with the way antidepressants are used, is that they're used for long term. And there's no evidence, good evidence for that. The Duke study was replicated 5 years later, and they came up with the exact same result, which is extremely concerning to say the least. The other thing that we should be noted here, and it's very important, is that antidepressants have a serious withdrawal syndrome, as do antipsychotic drugs. They are dangerous to withdraw from. In fact, it's often easier to withdraw from crack or heroin addiction because there's a short period of acute withdrawal. With an antidepressant, an SSRI, the withdrawal period goes on for months. With a heroin addict, after 3 or 4 days, they're back to a relatively normal state of mind. So we have drugs being prescribed that should only be used in the short term, only for the most severe, but we have them being prescribed for mild, moderate, and severe depressants for a very long period of time. And the paradigm has not worked. The more we spend on these drugs, the more the disease burden increases in our society. However, in Christchurch, where I'm from, at one point we had 1 in 4 adults, 25% of people being prescribed an SSRI antidepressant. And mental health here hasn't got better, I can tell you that. And in America, we have 1 in 4 women, adult women, currently being prescribed an antidepressant drug. This is causing an epidemic of drug-induced poor mental health. This isn't from street drugs. This is from doctor-prescribed antidepressants, antipsychotics being used incorrectly. Many antipsychotics now are being used as sleep remedies, anti-anxiety remedies, and anxiolytics. And this use is entirely inappropriate for these kind of drugs. Below, I'll provide the links for these very large, high-quality studies. Please leave any comment you want, and I'm going to continue this talk with what I think are some future directions. stay well, stay connected, stay in touch with people who you care about and people who care about you. And I look forward to chatting again.